evolving process, that you keep learning and learning. Doesn't mean that you get it right. I taught nursing at Marquette for about 10 years, and I had my students on community health, and I would have students who would come to me and say that, and I had students at a clinic in the Black community, and they would come to me and say that they were concerned about, what they would do. They didn't want to offend somebody. And I told them, I said, you're fine, because you recognize that it's possible. I said, if you do make a mistake, you'll be forgiven. People understand that. Now, the ones I had to watch, of course, never gave that concern. They had it all together, they knew what to do. Those are the ones I had to watch a lot more closely in terms of how they interacted with clients and expectations. And so I'd say that to say that you yourself has got to figure out where you are and what you're doing. And what is your nursing practice going to look like? And that's from, I started out in critical care. I ran county's critical care department. Well, they burn the hospital down, but so I've gone from critical care to neonatal to the community, to running community health centers. So I've kind of gone the gamut to then teaching. So all aspects of nursing I have been in, and the issue has always been basically the same, because you're looking at issues of class and race. And certainly in Milwaukee, which may not be, I know you guys are from, so it may not be such an issue, but certainly in Milwaukee, it's class and race that gets mixed together. So the hyper-segregation of class and race makes it even more intense in terms of people who don't interact with people, except maybe if you're a nurse, maybe it's in the ER, maybe it's when they're hospital. I tell nurses sometimes, I said, well, I don't know. I said, but I'm not my best when I come to the hospital. If that's the only time that you engage with people of other groups, then that's what stays with you. And that's kind of how you see it. What you have to be aware of is thinking that that's an isolated incident. Doesn't mean you got to go out and then all of a sudden associate with Black people or bad people, whatever. But it does say, well, maybe I need to, to think about this, to look at what I need to do, if I'm doing this correctly, if I'm making sense, And a story I always tell students too is a nurse I was working with actually in the critical care unit, and she said, Pat, I like working with you so much I forget you're Black. And I said, really? Why? Of course by then, this is a wonderful person, very wonderful. She was red, obviously, but she thought she was paying me a compliment. But what she didn't realize was that she had her stereotype of who Black people were. And I didn't fit that. I see dark, bright, my color, Black people, intellectually bright. It's good, one of the best ICU nurses, which I claim that myself. Right? I knew how to do stuff, so that wasn't her. But she didn't realize that until she said that to me, and my reaction to that. And how are you in places, and actually when I was working at the VA, in the ICU, we worked second shift all the time, and so we always ordered food. And we ordered food from all over, all kind of places. And there was some Chinese food once, and it was late. And this nurse says, oh, these Chinks, I don't know what's wrong with them, that they're so late. And I said, okay, help me here. You're going to denigrate a whole race of people for some late food? But what I said to her too was, well, I said, if you say that, because you don't have an Asian nurse standing here, so what do you say when I'm not around? What do you talk about? Oh, no, I wouldn't do that. But she wasn't convincing me because I rolled off her lips too well. But also becomes, where do people say things like that? Where are you in terms of enabling that kind of behavior? Because if you enable it, then it goes on and on and on. Doesn't mean you got to be a mad rabbit fighter like me. But people need to know that that's unacceptable, unprofessional. You may have certain opinions, but those opinions should not interfere with your professional behavior. And so that's what this is about. And if you can't do that, I would tell my students at Marquette, you can't work with Black people, you can't work with poor people, then go work someplace else. You got a lot of other choices that they do. And they have enough problems. They don't need you. Like you're doing them a favor or something, So it's getting you to really think about who and what you are. I'm going to show you, I'm going to talk about some concepts and some principles around cultural competence first, and then move into some of the training and lectures that I do on looking at, it says exemplars, that's looked at how does this work then with African Americans? And I want to be very clear that I speak, I had to do a presentation 2 weeks ago, and it was about boys and men of color. And when they asked me to speak, they asked me to speak, do a presentation I did on African American men of color. So then all of a sudden it got switched to boys and African American men, period. Then it got switched to boys and men of color, and I had to make it very clear to them, I'm sorry, I can only speak about African Americans, that's what I know. I don't presume to know about what other people do, what they say. I leave that to them, right? And that includes African people too. I don't run around talking about, even though we got the first half. You know, and I think that's important that you don't think, but sometimes, and like I said, I've been nursing 40 years, I've seen some evolution of not expecting people to just see everybody is the same, because everybody's not the same.